OpenAI and Boston Children's Hospital just published results in NEJM AI showing a 3 deep research diagnosed 18 previously unsolved pediatric genetic cases out of 376 analyzed. One patient, Kyra, had been seeking answers since age 9 and received her diagnosis at 28. That's not hype, that's a peer-reviewed outcome in one of the world's most rigorous medical journals. Here's what actually happened. The research team used O3 deep research on genetic cases where traditional diagnostic protocols had failed. The cases were real, documented, difficult. The model didn't replace the clinicians, it augmented their reasoning on the hardest cases in their queue. 18 diagnoses out of 376 is a 4.8% success rate on unsolved cases. For genetic mysteries, that's significant. These aren't edge cases. These are families who've spent years and tens of thousands of dollars searching for answers. The publication in NEJM AI matters because it's not an internal benchmark, it's external validation. Peer review means independent radiologists and geneticists reviewed the methodology, the cases, the evidence. That's the difference between a vendor claim and a signal builders can actually trust. But let's be precise about what this is and isn't. This is evidence that O3 deep research can recognize diagnostic patterns in genetic data when given structured clinical context. It's not evidence that it's better than human geneticists. It's not evidence that it solves the broader diagnostic problem. It shows a narrow capability applied to a specific hard problem where traditional methods failed. For AI builders and operators, this signals something critical. The value isn't in speed or cost reduction at this stage, it's in extending diagnostic reach on unsolved cases. The constraint isn't the model anymore, it's workflow integration, evidence thresholds, liability frameworks, and how you get this tool into the hands of clinicians who need it, without disrupting their existing process. One patient had 19 years of unanswered questions. A model gave her an answer. That's the real benchmark, not NEJM publications or accuracy percentages. It's what changes in a human life. What to watch? Generalization beyond genetic cases, replication across other hospitals, false positive rates on cases where a diagnosis was already known, and adoption timelines for clinical workflows. If you want to track moves like this, real capability signals buried in peer-reviewed research, not hype cycles. Join the community. Link in the description. Build the system. Automate the rest.